We would like to thank our speakers, Mrs. Afnan Zayani and past President Maish Maitali, and our moderator, past District Governor Najad Latasi, for such a beautiful session. For we all know, without women, there will never be a better tomorrow. Dick Van Dyke believes that women will never be as successful as men because they have no wives to advise them. And I know what men are thinking now. Oh, women, we can't live with them, can't live without them. Jokes aside, let's talk COVID-19. Our fourth plenary session is disease prevention and treatment. Our speaker is Her Excellency Dr. Maryam Al Jalahma, Chief Executive Officer of the National Health Regulatory Authority in the Kingdom of Bahrain. Dr. Maryam, the floor is yours.
Good morning, dear guests, organizers. Thank you very much for inviting me to this important event where we meet in an unprecedented time with the spread of the COVID-19 pandemic all over the world, which has created challenges, huge challenges, in fact, for all the healthcare sectors and countries. And I'm here to share with you Bahrain's experience in combating the COVID-19 and how we were able, under our tremendous leadership, to maintain the infrastructure and maintain the capability to track, trace, and treat every individual living in this land. Since the WHO announced that this is a world pandemic in January 2020, immediately a task force was established in Bahrain. Of course, the most important thing is that our leadership support, and with the government support headed by His Royal Highness, the Crown Prince Sheikh Salman bin Hamad Al Khalifa, Crown Prince Prime Minister. This was a joint effort between all ministries and authorities in the country, because we did not tackle the COVID-19 as a disease and its Ministry of Health issue to deal with. This time it's different. We treated it like an enemy, and we have a war that we all have to fight together. So immediately the disaster and response plan was activated, where it is actually there is the disaster plan shared by His Excellency the Minister of Interior and with other ministers to discuss the preparations. And also we had a national task force and a national team, medical team, that meet daily to see the reports and make decisions and raise it up to the government for approval. Having a solid infrastructure is a privilege in Bahrain, where we have, besides the 3 major government hospitals, we have 19 private hospitals, 28 primary healthcare centers that belong to the government, and over 200 centers in the private sector. This help us to maintain providing regular health services besides combating the pandemic at the same time. Now, as I said, that establishing a national task force was very important. And as I said, this is considered as an enemy and we have a war against it. So immediately an operational room, where we call it the war room, it was a central command room to report all the data and statistics and what's going on in the world and communicate between different teams. It was very important. Also, Bahrain developed a national number, which is 444 for all citizens to reach for if they have any queries, questions, or reports. A central triaging and screening center, and now we developed more than one, because the most important thing to fight this pandemic is, as I said, the 3 T's: track, trace, and treat. And so on. There was also a dedicated places to treat severe cases, moderate cases, and mild cases as well. Besides implementing a phone application where all the information related to the patient or the person will be announced there in this application to track the PCR results, to track their vaccination certificate, to report any side effects, to have any queries, to update information. So this is tremendous. I mean, when we look into how this pandemic utilized all the forces, and the IT was number one in the most important one to support how to deal with such a pandemic. Also, there was a dedicated media team. So information will be central. As you know, that social media, you will find everybody posting any news, any false information, even from some doctors all over the world. So in Bahrain, we decided to have a central media team, a central press conference where all the information to be taken from this source to avoid false information. As you know, it will create chaos and panic in the society. Making access to tests very easy, and you get the results within 24 hours. Partnership with other government entities was very important. The Ministry of Information, the Ministry of Interior, Ministry of Health, the National Health Regulatory Authority, where I chair, all the entities, the military, everybody work as one team. And you can't say that this is my position, this is what I do. No, we work all together. Partnership with the private sector was very important. When we needed beds, and we diverted the non-COVID cases to the private sector. We even transferred some of the patients and deliveries to them. We empower them to do the tests for those who are willing to travel or do the elective tests. They even supported us with the staff. They were really strong partner with us, because that's what the health infrastructure in Bahrain is based on, not only the government sector. So that's why you will never see the health system collapse like what happened with other countries. Also, the international and regional collaboration. We work very closely with our GCC countries to unify the guidelines and protocols, and work very closely with the World Health Organization as well. And this is very important. Then we come to what the government did, where it provided the vaccine. Whenever there is a vaccine coming up approved by the international bodies, immediately Bahrain approve it. And, you can see that this country has more than one vaccine. It's a choice of a person to choose. And we modify the protocol of vaccination as we go on. Now we are maybe the first country to introduce a third dose for those vulnerable at risk, where we believe that maybe they will, their immunity will decrease by time, and we need to boost it. Then when we come to the most updated drugs, because, this is a new virus and science has been competing to provide the most appropriate treatment. So in Bahrain, always make all the drugs available, either to introduce it as a drug that is approved, or even to participate in clinical trials with the world, like we did. It was the first and the most important clinical trial that was hosted by Bahrain on the Sinopharm vaccine. So all these efforts come together to compete the COVID. With that, I would like to stop and maybe receive questions from you to elaborate more on our experience. Thank you very much.
Thank you, Dr. Maryam, for you talked about a subject that is of vital importance to us all, and by us, I mean humanity. Now we will start the Q&A with past District Governor Najad Al-Attasi.